आज हमारे साथ ब्रिजेश जी हैं। हमने इनका 2022 मई में हेयर ट्रांसप्लांट किया था और आज हम उनसे जानेंगे कि उनके हेयर लॉस की जर्नी के बारे में और कैसा उनका पूरा एक्सपीरियंस रहा है इस बारे में। तो ब्रिजेश जी, आपका स्वागत है हमारे हॉस्पिटल में, हमारे स्टूडियो में। तो ब्रिजेश जी, प्लीज़ अपने बारे में बताएं कि आपका हेयर लॉस कब शुरू हुआ, कैसे रहा, और कुछ अपने बारे में बताएं और हमारे बारे में आपको कैसे पता लगा।
जी, मेरा नाम ब्रिजेश सिंह है। मैं एमपी का रहने वाला हूँ। मेरा हेयर लॉस काफ़ी समय से हो रहा था, तो मैंने नेट पे सर्च किया तो सारस्वत हॉस्पिटल मेरे को मतलब ठीक लगा, मेरे नज़दीक भी था। तो मैंने जाके विज़िट किया डॉक्टर साहब के पास, तो उन्होंने मुझे अच्छी तरीके से समझाया। उसके बाद मैं 2022 में हेयर ट्रांसप्लांट कराया था। तो मेरा आपके सामने ये रिजल्ट है। आज मैं बहुत ज़्यादा खुश हूँ।
तो जब आप यहाँ पहली बार आए थे तो आपने किस तरह से हमारी टीम से संपर्क किया और क्या आपको उसमें दिक्कत हुई किसी तरह की, या वो स्मूथ था?
बिल्कुल नॉर्मल था सब कुछ, बहुत अच्छा लगा मुझे यहाँ पे आके।
और पहली बार जब कंसल्टेशन के लिए आए थे तो आपकी प्लानिंग आपको प्रॉपर समझ में आया था कि हम कैसे कैसे क्या क्या करने वाले?
हाँ जी, बिल्कुल मुझे सब कुछ क्लियर हो गया था, सब कुछ डॉक्टर साहब ने बताया हुआ था।
हमारी टीम के भी कुछ लोग आपसे संपर्क में थे जिन्होंने आपको प्रोसीजर के बारे में कुछ समझाया था?
हाँ जी, डॉक्टर साहब ने मुझे सब कुछ बता दिया था कि क्या से क्या होगा, कौन से टेस्ट होंगे, सब कुछ।
ठीक है। और जो आपको ऑपरेशन रहा था, थोड़ा सा उसके बारे में विस्तार से बताएं कैसे?
जी, बहुत अच्छा लगा मुझे, कुछ भी पता नहीं चला, सब कुछ नॉर्मल है। अभी सब कुछ नॉर्मल चल रहा है।
जब सर्जरी हुई थी तो पेन कैसा था, कितना था?
बिल्कुल नॉर्मल था, कुछ भी पता नहीं चल रहा था।
अच्छा, तो आप या आपके घर में, परिवार में, या जो भी लोग आपको जानते हैं जिन्होंने इसके बिना आपको देखा था, तो उनकी नज़र में अब आप कुछ परिवर्तन आया, या आपको खुद कैसा लगता है, खुद कैसा?
मुझे खुद पे अभी कॉन्फिडेंस हो गया है। बाकी मुझे जो कोई देखता है वो पता नहीं लगा सकता कि क्या है।
नेचुरल लगता है,
नेचुरल है।
आपको? आप सेटिस्फाइड है, आप खुश हैं?
बिल्कुल खुश हूँ मैं आज।
अच्छा। और कुछ लोगों ने आपको कभी बोला कि हाँ आपके रिजल्ट बाल बहुत अच्छे हैं, पहले कम थे, ऐसे भी कौन?
हाँ, हमारे मतलब बहुत से दोस्त मुझे बोलते हैं कि भाई तेरे बाल बहुत अच्छे हैं। तो मैं डॉक्टर साहब के बारे में सलाह दी कि भाई वहाँ चले जाओ,
अच्छा।
वहाँ आपको सब बढ़िया मिलेगा।
और ऑपरेशन के बाद में आपको कितनी बार आना पड़ा, या उसके लिए आपको जैसे कोऑर्डिनेट करना होता है पीआरपी या कुछ चीज़ों के लिए, तो वो कैसा रहा उसका एक्सपीरियंस?
केवल एक फ़ोन करता हूँ मैं कि सर मैं आज आ रहा हूँ, मेरी पीआरपी होनी है, तो वो सब बोलते हैं हाँ ठीक है आ जाओ, कोई नहीं मैं करवा दूँगा।
बहुत बढ़िया, बहुत बढ़िया। हमारे हॉस्पिटल के बारे में, स्टाफ के बारे में कुछ कहना चाहिए?
बहुत अच्छा स्टाफ है, एक नंबर, मतलब हॉस्पिटल बढ़िया हॉस्पिटल है और कोई दिक्कत नहीं है।
थैंक यू, बहुत बहुत आपका धन्यवाद अपना एक्सपीरियंस शेयर करने के लिए, और आपका पुनः स्वागत है। थैंक यू।
नमस्कार।
So friends, you listen to Mr. Rajesh's testimonial about his hair transplant and his results after 2 years. And in this talk, he told us that he was quite concerned about his hair loss when he was just 27 years of age and suffering from almost a grade 5 Norwood male pattern baldness. And he had tried some medical treatment. Then he came to us and consulted with us, and we did his hair transplant. So before we go further and discuss his planning in detail, I request you to subscribe to our channel where you can find such informative videos. I am Dr. Satya Saraswat, a gold medalist plastic surgeon, and in this field for hair transplant for around 17 years or more. So when Mr. Brijesh came to us for the consultation around 2 years back regarding his hair transplant procedure, we did his trichoscopy, and I remember that his trichoscopy finding was amazing in the way that even though his density was on the normal side, like 80 follicular units per centimeter square density was there in the occipital and left and right parietal region, but his hair thickness was extremely good. It was around 0.08 millimeter. Also, one important thing which we found out during his trichoscopy, that we did a sampling of around 30-40 hairs or the follicles in his donor site, and we found out 100% of his hairs were terminal. This means that the thickness of hairs is more than or equal to 0.06 millimeter. And as you know that the hair volume depends on the square of the radius of the hair. So thicker the hair volume which we get out of hair transplant is on the very higher side. So with the 100% terminal hairs and such a great thickness we found out in his donor, we were very confident that we can deliver very good results to him, and this also we discussed with him in detail. His donor area was quite extensive, almost 175 centimeters square donor area. His width was around 6 centimeter, which is much more than usual. Generally it's around 5 centimeter, but with that extra 1 centimeter width, the total donor area increased to around 175 centimeter square. And with the average density of 80 follicular units per centimeter square, his total number of grafts were almost 14,000. So we knew that his source was very good. If you have doubts about your planning of the hair transplant, you can mention in the comment section below about your particulars, about your trichoscopy finding, and we will try to help out with you, and we will try to guide you about the questions which you should be asking with your hair transplant surgeon. Or if you want to take our help, then also you can try to connect with us, and you can write down your contact details in the comment section below, and our team will try to reach out to you. His recipient, or the bald area, was around 122 centimeters square. We planned a density of 35 follicular units per centimeter square, which is around 45% of the normal density. As his normal density was 80, 45% of that is around 36. So with this kind of density, we planned to give him around 4,270 grafts, which were the ones we extracted in his case, and then we inserted the same number of grafts. Do like this video if you like the planning which we do in individual patient. You can see on the screen the distribution of 1 hair, 2 hair, 3 hair and 4 hair follicles. This is mentioned on the screen along with the number of hairs, or the total number of hairs which we got out in his case. If you are also looking out for your hair loss solutions or hair transplant, please call us or WhatsApp us on the numbers mentioned on the screen. Now describing or discussing the steps which we do, they are standard procedures which we are following. First is, after trimming the hairs, we give local anesthesia, and that is done after doing all the sensitivity for the local anesthesia and doing an ECG, and all the preventive precautionary measures are taken. After that, we give local anesthesia all around. This is done in 2 planes, deep and superficial, along with some special instruments which minimize the discomfort of this local anesthesia also. Then we make the required number of slits, keeping in mind the normal angle and direction, and for this we use the CTS blade, and sometimes we use the sapphire blades also as per the requirement. And after that, we extract the grafts on the back by using a very low speed machine. A high speed machine of say 30 or 35,000 RPM or rotation per minute can cause a lot of transaction or damage to the roots from the donor side, whereas the one we use has a RPM of 300 to 600 rotation per minute, which is extremely slow. There is no thermal heat generation in the donor side, which means that there is hardly any damage to the roots because of the heat. Also, the transaction is very low because the punch is moving very slowly in these cases. After the extraction, the grafts are collected with the ATOE forceps or a non-traumatic forceps, and after that the collected grafts are sorted at the back end using a magnification device or a microscope, and they are segregated or sorted into 1 hair, 2 hair, 3 hair and 4 hair graft. 1 hair is used for the hairline, typically for a couple of rows, and then 3 and 4 are used specially for the frontal tuft, and rest of them are inserted in the remaining areas. And this is done with the help of the technical staff. In between, we have to take a lot of precautionary measures that the graft should not dry or desiccate, because desiccation can cause the grafts can become non-viable or dead. Also, they have to be continuously kept hydrated, and the movement has to be very well coordinated. If there are repeated attempts to put a graft, it is said that if you are trying it for 3 or 4 times, the grafts can die off if you are trying to hold it repeatedly. And we try to use a no root touch technique, where we are holding the roots only from the top, not from the bottom. And sometimes we use implanted devices also if needed. After this is finished, we call the patients for shampooing and then PRP later on, and then the patient is continuously in follow-up. Then, we just keep an eye or the track on the kind of hair loss he is having. We prescribe him some medicines to prevent his further hair loss and to promote the growth of the transplanted hairs also. So this is the step-by-step procedures which we do in each and every case. We request you to share this video with your friends or colleagues or your family members who are looking out for hair transplant, so that they can know that the planning is extremely important in each and every case. We would also like to show you the combing videos, both dry combing and wet combing. The actual hair volume is seen only in wet combing videos, which most of the doctors or clinic actually do not want to discuss about or do not share. Dry hair, especially if they are long length, can give a false feeling of a good hair volume, whereas the wet combing videos give you an actual picture of the hair volume generated out of hair transplant. So in these videos, you can see how good his hair volume looks, how natural the hair transplant looks, and how natural the hairline is in his case. To know the cost of hair transplant, please click the video on the left, and to know or see a result of one of our other hair transplant patient, please click the video on the right. Thank you.